Most cases of acute diarrhea are self-limiting. However, there are several red flags need to be aware of from A to D. A. Acute abdominal sign. B. Bloody diarrhea. C. Cholera. D. Dehydration. A. Special attention should be paid to exclude signs of peritonism and acute abdomen, which will indicate serious illnesses that might require surgical care. For example, appendicitis, adnexitis, diverticulitis, ischemic enterocolitis, mesenteric artery venous occlusion. B. Most acute bloody diarrhea is caused by Shigella species and Campylobacter jejuni or other enteric pathogens. Bloody diarrhea is often accompanied by fever that may persist for longer than 2 days and may be higher than 38.5 degrees Celsius. Dysentery is characterized by the frequent passage of small volume stools, usually 10 to 30 times a day, consisting of blood, mucus, and pus. This diarrhea is accompanied by abdominal cramps and tenesmus, the painful straining at stool. Rare complications include seizure, hemolytic uremic syndrome, in particular bacteria strain. C. Cholera is an acute diarrheal disease caused by the bacterium Vibrio cholerae, spread through contaminated water and food. Cholera can cause severe diarrhea, dehydration, and even death if the disease goes untreated. Most patients do not develop any symptoms. Others may develop severe watery diarrhea with rice water-like stool and vomiting. It is important to determine the degree of dehydration in order to select the appropriate plan to treat or prevent dehydration. There are different parameters to assess the degree of dehydration. For example, Clinical Dehydration Scale, the World Health Organization scale, and the Gorelick scale in identifying dehydration in children with acute gastroenteritis. There are, however, no quick, easy, and infallible tests for dehydration among the elderly. Chan medical tips. Although the majority of acute diarrhea are self-limiting, there are several red flags need to be aware of from A to D: acute abdominal sign, bloody diarrhea, cholera, and dehydration. Thank you.